Hello and thank you for clicking on this video. My name's Kris, I'm an Australian GP and welcome back to my Health Issues 101 series. Today we're going to be talking about cholesterol. We've done quite a few heart-related videos recently. We've done heart health and blood pressure, and cholesterol was covered a little bit in both of those. However, it does deserve its own video because it's so important and quite commonly misunderstood. So cholesterol is a fat-like substance that your body produces naturally, located within the body's bloodstream. Cholesterol is actually really important because it helps make new cells, several hormones, and some enzymes to help digest food. Having cholesterol on its own is not actually a bad thing. Like I said, we need it. So when we have elevated cholesterol, especially certain types of cholesterol that then embed in areas that it shouldn't, that we have an increased risk of having health problems, particularly cardiovascular disease. There are three main types of cholesterol: LDL, HDL, and triglycerides. LDL, or low density lipoprotein, is the bad cholesterol that people have probably heard about before. This type of cholesterol joins with the other type, triglyceride, which is more of a fatty substance, and can build up in the inner wall of your arteries, which can occlude them and make them much more narrower, stiffer, and harder to compensate for changes in blood pressure. If a buildup of this cholesterol and triglyceride combination, called a plaque, ruptures, that rupture can send a clot off, which can precipitate a heart attack or a stroke. So it is important not to have too much of this bad cholesterol. Next up is HDL, or high density lipoprotein, also known as good cholesterol. Good cholesterol removes bad cholesterol from the arteries and returns it to the liver so it can be metabolized appropriately to then make those enzymes or hormones or so on. And then finally, we touched on triglycerides, which are a type of fat that we do obtain from the diet, which, as I said, can combine with LDL, bad cholesterol, to form plaque. Mind you, our body also does produce some triglycerides, so it's not solely diet related. So what are the causes? A lot of hypercholesterolemia, or high cholesterol, can be linked back to the diet. However, this is not always the case and is sometimes a risk factor that someone with high cholesterol just doesn't have. Smoking is known to increase cholesterol, as does having excess weight on you, so being overweight or obese. Some medical conditions like chronic kidney disease can also increase your risk of having high cholesterol, as can age and your ethnicity, so things that you can't change. Finally, something else you can't change is your family history. And there are some genetic conditions like a familial hypercholesterolemia, or a inherited high cholesterol, that predisposes you to having high cholesterol regardless if you're a non-smoker, normal weighted, normal diet, everything. So there are lots of risk factors for having high cholesterol. Symptom-wise, having high cholesterol has no symptoms until it starts to affect either your blood pressure, or you have it tested in your blood, but that's actually not a symptom, is it? Or if it causes a problem. So it's silent. Hence why it's really important that we as GPs are cognizant of cholesterol, are looking for it, and can help you manage it. When I say investigations, I'm talking about a fasting cholesterol panel, which looks at your total cholesterol, your LDL, your HDL, your triglycerides, and the ratios between them. Generally, when we're checking cholesterol, we're looking at other risk factors for heart health and kidney health and brain health as well. So we'll often also order your sugars, your liver and kidney function, a full blood count, and look at things like your height, your weight, your dietary intake, your blood pressure. Basically getting an overview of you and your risk factors. If you are found to have high cholesterol, there are several things that we can do. Quite often, if it's only mildly elevated, it's the first time, or if you don't have any other risk factors for heart disease or stroke or other problems associated with high cholesterol, we will chat to you about modifying your diet for the next 6 months. Sometimes this involves chatting to a dietitian about what foods contain cholesterol, what good fats you actually do need in your diet, because like I've alluded to several times, cholesterol is not inherently bad. It's having too much of the wrong type that's bad. We'll also encourage you to stop smoking if you are a smoker, and to engage in more physical activity during your week. However, sometimes, despite all of this, people's cholesterols can still be high, and it's not a failure on your part, but it is something that we need to action. And this is when we'll start talking about medications. And the most common class of medications are the statins. So rosuvastatin, atorvastatin, there's a couple of them. These medications prevent the production of cholesterol from the liver, but there are other medications as well which reduce the amount of cholesterol you absorb in the diet and can change the metabolism of cholesterol. Essentially, we care about these numbers because of the impact they can have on you long term. And that's it. It's a really quick one today, guys. Cholesterol 101. I hope you've learned something. If you have any questions, let me know down below. Let me know what kind of videos you would want to see from me in the future. I'm really enjoying doing these health conditions 101, but obviously I'm happy to branch out as well if there's any particular topics you want me to cover. Don't forget to like, subscribe, and until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.